It's a big day at the White House as President Trump signed a massive opioid bill into law.
It's aimed at fighting what the president declared as a national health emergency a year ago, which hit hard, of course, in West Virginia and surrounding states. 13 News Chief Political Reporter Mark Curtis joins us now live at the White House with more on that. Mark.
Well, Jennifer and Patrick, you can see the sun setting on the beautiful Capitol dome behind me. Perhaps those aren't just rays of sunshine, those are rays of optimism. Look, we all know how horrifying the opioid crisis has been, not only in West Virginia, but in all 5 surrounding Appalachian states. Well, today, with a huge bipartisan majority in Congress and the president's signature, we may see some progress.
President Trump signing a 600-page bill to fight the opioid crisis into law. It will provide $8 billion in the next year to battle the addiction epidemic. Many items in the national bill are cloned from ideas from West Virginia, the state hardest hit. There will be more national care for drug-addicted babies modeled after Lily's place in Huntington. And there will be more quick response teams that treat overdoses, also modeled after that same city.
This is a big milestone. It's a conglomeration of a lot of great ideas, some of which are working in West Virginia now, like Lily's Place or the Martinsburg Initiative.
The bill provides more federal aid to state and local law enforcement.
Because one of the things we got to do is stem the flow of these drugs coming into the country, especially fentanyl. And we know that with fentanyl, that is a killer, just a trace of it that they're putting in cocaine and heroin and marijuana. It's killing people.
There will also be a lot more money aimed at prevention and long-term treatment for addicts. That has been in short supply nationally and locally.
We have a lot of programs for people who are drug addicted that last for 30 days or 60 days. That's not adequate because the changes that occur in the brain normally take somewhere between 12 and 18 months.
Dr. Carson saw the problem in Charleston firsthand. First Lady Melania Trump, the president and vice president, and several cabinet members have all come to West Virginia to discuss opioids. The White House says to expect more visits.
I think you said it exactly. It's one of the places where we've seen a real impact and certainly want to be able to address this. This is obviously a countrywide problem, but certainly we have seen it be really heavily hit in West Virginia, and we want to make sure we're doing everything we can.
West Virginia continues to have the highest drug overdose death rate in the nation.
In all, over 70 lawmakers from both parties had their hands on writing this legislation, including all 5 members of the West Virginia congressional delegation, as well as many members of Congress from our surrounding states. We'll keep an eye on the story and see how it progresses and see if it puts a dent, indeed, in our severe opioid crisis. Reporting live in the nation's capital, I'm Mark Curtis, 13 News, working for you.